Lower back pain 101. Did you know that lower back pain affects 80% of the population at some point in their life? And 1/3 of the population suffers from back pain on a yearly basis? Low back pain is the single most common cause of disability in workers under the age of 40. Your low back is made up of 5 different bones called vertebrae, stacked on top of each other with a soft, shock-absorbing disc in between each level. The spinal cord lives behind the vertebra and nerve roots emerge from the different sides. There's many causes of low back pain, but there's 2 major culprits that we talk about. 1, lumbar disc lesions, where the disc material bulges backwards, which can potentially irritate the spinal nerve. Or lumbar degeneration, where discs are thinned out over time, which narrows the opening where the nerve exits. But one of the most overlooked causes of back pain comes from a slightly restricted joint. Let's understand this. Imagine a normal back that functions like a spring and moves freely in each direction. A back with a joint restriction is like having a section of that spring welded together. The spring, it might still move as a whole, but a portion of it is no longer functioning. This is what we refer to as chiropractors as joint restrictions. Joint restrictions, they develop in a number of ways. Sometimes they're brought on by a big injury such as a fall or an auto accident. But more commonly, they develop slowly and gradually from repetitive strains, such as sitting with poor posture for long periods. Joint restrictions go through a cycle of discomfort, starting with swelling, then inflammation, then it turns into guarding of the muscles and leads to more restriction over time. Joint restrictions most commonly cause local tenderness and discomfort. You may notice that your range of motion is limited and that there's certain movements that intensify your discomfort. Pain from a restricted lumbar joint often trickles into the hips or thighs. Long-lasting restrictions can result in arthritis, in much of the same way like a misaligned wheel can end up causing premature wearing of the tires in your car. Fortunately, we as chiropractors are very good at relieving low back pain with a variety of therapies and treatments to help release muscle tightness and decrease inflammation if there is pain present. We can perform myofascial release to help release trigger points in chronically tight muscles, to exercises to make you feel more flexible and stronger. But our unique ability as chiropractors is to restore movement to restricted joints with adjustments or spinal manipulations. There's various studies comparing manipulation to medication. It's been concluded that chiropractic patients recover faster with greater quality and better life. It's no surprise that many medical groups have published papers on endorsing chiropractic and manipulation. So, if you or someone that you know is suffering from low back pain, trust the safe, effective, natural alternative way first. The right movement is medicine, and we will help find that right movement for you.